Now let's have a look at some of the diseases which are caused by bacteria. The first one for us to discuss is tuberculosis, or in short what we call as TB. Now when we talk about TB is a disease which has been one of the leading causes of deaths worldwide. Just imagine 2020, the year when COVID-19 started to lay its havoc. Tuberculosis was the second highest killer in the world. A total of 1.5 million people died in 2020 just because of tuberculosis. So that's why tuberculosis has been one of the leading killers of the world entirely. There are basically two types of TB, one which is called as latent TB and the other one which is called as active TB. Now, latent TB may remain in the person for a very long time without the person realizing, without it showing any symptoms as such, but at the same time, if the same converts into active TB, it can become a major problem. So that's why even if latent TB is detected, then it has to be treated so that it does not develop into active TB, because if it develops into active TB, then in that case it can become difficulty for the patient. Now it's not that the fatality rates are high. Fatality rates are reasonably low when it comes to TB. Also, although it is infectious, it is contagious, but at the same time, the infection rates are not as high as many of the other diseases that we discussed. So for example, you would not catch TB from a stranger. Chances are higher that if you are living with somebody who is a TB patient, or you see them on a daily basis, then in that case the chances are higher that you will catch TB from them. Otherwise, it will not happen in case of what we have seen with some highly contagious diseases. For example, what we know of COVID-19 also, such cases will not be observed when it comes to TB. So, mode of transmission, it is airborne, discharged through the sputum, cough or sneezing. That's why it can be called as a droplet infection. Alright. Now, incubation period generally will be 2 to 12 weeks. Basically, in this period, tuberculin will be generated, and once tuberculin has spread in the body, this is when the symptoms of the disease will start to show. Then for prevention, you have the BCG vaccine. Now, last couple of decades, it has been seen that BCG vaccine is being not administered unless it is required. Only in cases where the number of cases can be high or chances of infection are high, these are the kinds of areas where BCG vaccine is given. Otherwise, what we have seen is that especially in the developed countries, BCG vaccine is not being given anymore. There are many other vaccines which are in trials, and these are the vaccines which will replace the BCG vaccine. One of the reasons also for BCG vaccine not to be used basically is that it shows a lot of false positives. So that's why BCG vaccine is used only if required. Otherwise, normally it is not widely used. Now, the pathogen that causes tuberculosis is Mycobacterium tuberculosis. So the name itself will suggest you what the disease is and where it is coming from. Talking about the symptoms, first, cough with sputum and blood, fever or night sweats, weight loss, a drastic weight loss happens, and chest pain. Then after that, somebody who is coughing, the coughing goes on for a very long time. For example, it may very easily go beyond 2 to 3 weeks, and it will persist for a very long time. So if for somebody who is living in your vicinity, or you yourself ever see that the cough is continuing for more than 3 weeks of time, then in that case you have to make sure that you get tested, that it is not a major issue, it is a normal cough. Because in case of tuberculosis, we see that patients keep coughing for a very long duration of time. Then fever or night sweats, and this is also one of the symptoms, that somebody who is waking up with sweats in the morning should get tested, because there are chances that this could be a symptom of tuberculosis. Then after that, extensive weight loss is seen in the individuals, in the patients, and chest pain is often a complaint of the patient. Now diagnosis, if you talk about, blood test can be done which will show whether or not tuberculosis exists. Then there is an imaging test for understanding whether there is a lung infection, because tuberculosis basically is an infection of the lungs, correct? So that's why this imaging will tell you whether or not tuberculosis exists. And then sputum test is something else that is done to understand whether bacteria of tuberculosis exist or not. Then prevention and cure. First of all, BCG vaccine is one of the leading vaccines. Hygiene and clean surroundings, isolation of the patients, treatable. It is known that it is a completely treatable disease. Multiple antibiotics have to be taken for a long duration of time. Generally, the medicines run for a long duration, that you might be asked to take medicines for more than 6 months of time, for example. But largely it can be treated, it can be taken care of. So 6 to 9 months of 4 antimicrobial drugs are taken, and that will take care of TB. So as a prevention, what also is suggested is that the rooms should always be airy. The room should be airy. There should be enough ventilation in the room, because when we talk about the bacteria, this bacteria grows more and grows rapidly if the rooms are closed and there is no proper ventilation in the rooms. So that's why that's also something that is suggested as a preventive measure. Now when it comes to tuberculosis, there are many variants of tuberculosis. The normal tuberculosis can be treated in these manner, but there is a specific kind of tuberculosis which is called as MDR-TB, which basically means multiple drug resistant TB. Apart from that, there is another variant which is called as XDR-TB. So XDR basically stands for extensively drug resistant. Now what do we mean by these variants? First one is multiple drug resistant TB. What we have seen in cases of TB is that the normal medication and the normal vaccination sometimes fail in case of treatment of TB. So in these cases we call it as multiple drug resistant TB, because this is a case where the normal drugs are not actually working and the bacteria which is infecting the patient is actually drug resistant. We'll discuss the meaning of drug resistance in the coming sections, but just understand this for now, that there are cases where the normal treatment or the normal medicines against TB do not work, and in this case we call it as multiple drug resistant TB. Now in extreme cases, there are cases that have been seen which are called as XDR-TB, extremely extensively drug resistant TB. What happens in this is that even the medication that normally works with MDR-TB, even that doesn't work when it comes to XDR-TB. Now XDR-TB, if you go back to the history of the first isolation of the cases of XDR-TB, what was observed is that it started to develop in patients who actually were wrongly diagnosed of multiple drug resistant TB. Multiple drug resistant TB was not handled properly, and it led to a new variance in the bacteria, and this became extensively drug resistant TB or XDR-TB. So XDR-TB is even a more dangerous form of TB where the normal drugs do not work, and even the ones that could have worked against multiple drug resistant TB, even they do not work. So in that case we call it as XDR-TB. So this is about tuberculosis. Apart from these variants, there is another case that we have seen in the past which is called as zoonotic TB. So zoonotic TB is the kind of TB which is seen in animals, especially the cattle. So that is called as zoonotic TB. Moving on to the next disease, typhoid. Now when we talk about typhoid, first of all, it spreads through contaminated food and water, something that can become very common during the monsoon season, because that's the season where the growth of bacteria is higher as compared to the other seasons. So in case of summer season or in monsoon season, we see that the number of cases of typhoid are higher as compared to other seasons in India. Incubation period can be 1 to 2 weeks. Prevention can be done through vaccine, but it is completely treatable disease. So that's why whenever the symptoms develop, what kind of symptoms? Prolonged fever, fatigue, headache, nausea, abdominal pain. These are some of the symptoms that will develop as a first stage. In some cases it can become severe. When it becomes severe, we may observe ruptured ulcers when medical tests are done. Rashes will start to appear on the body, and it can become fatal in certain cases. Now it's again, the fatality rate is very low because it is completely treatable disease, and symptoms, as soon as the symptoms show, if somebody goes for treatment, then in that case it can be very easily contained and the bacteria will be killed very easily. But at the same time, the precautions have to be taken, because if these symptoms have developed, the patient needs to ensure that a proper treatment for typhoid is happening. So that's why when we talk about the prevention and cure, first of all, hygiene matters a lot, because it can propagate through contaminated food and water. So that's why exposed food and drinks, frequent hash-fall. So that's why exposed food and drinks can be a major problem. So that's why they have to be kept properly. Then hygienic conditions have to be maintained so that contamination of any kind can be prevented. Frequent hand wash will ensure that contamination does not spread. Fresh cooked hot food has to be eaten, or properly cooked food has to be eaten. And then vaccination can help. But again, vaccination normally is not taken against typhoid, mainly because it can be contained very easily with treatment. So that's why vaccination generally is not taken against typhoid. Moving on to the next disease, that is cholera. So first of all, again, for cholera also, the mode of transmission will be through contaminated food and water. But this time, cholera, when it comes to cholera, it develops very quickly. The incubation period can be as low as just 12 hours and it can be up to 5 days. So there is cholera vaccine again available against it. But generally, again, vaccine against cholera is not taken. What are the symptoms? It can lead to acute diarrhea and watery stool. Dehydration will happen, and it can in extreme cases also lead to shock and seizure in the patient. But in only extreme cases, it doesn't happen in all the cases. So prevention and cure wise, first of all, electrolytes have to be taken as treatment. Prevention wise, there is a cholera vaccine available, but again, normally cholera vaccine is not really taken. Electrolytes, because there will be a lot of fluid loss that will happen because of diarrhea and watery stool. So that's why a lot of electrolytes have to be taken by the patient. Then we need to maintain clean and properly cooked food, especially in the summer and the monsoon seasons, because again these are the seasons where the chances of cholera spread are much higher as compared to other seasons. Then hygienic disposal of vomit and human excreta, and then covered eatables and utensils, because contaminated food and water especially can become a huge source of spread of cholera. So that's why all these are the preventive steps that have to be taken against cholera. Now the next disease is diphtheria. So first of all, when we talk about diphtheria, you have to remember this, that this is a disease which is seen in children who are below 5 years of age. So that's why this is not a disease that occurs in adults. So adults will not get affected by diseases, because our mechanism of the body over a period of time develops a resistance against this disease, and that's why adults do not get affected by diphtheria. But children below 5 years of age are highly susceptible to this particular disease. So there is this vaccine that is given to small children, especially to children who are below the age of 2 years. This DPT vaccine is given to them so that they can be prevented against this disease. So it is a kind of a respiratory droplet disease and a direct contact disease that can happen through coughing and sneezing of the children, and can spread very quickly among the children who are not vaccinated. So incubation period is just 2 to 5 days, and within 5 days the symptoms will start to develop in the child. So symptoms can be sore throat, low fever, swollen glands in the neck, breathing and swallowing issues due to dead tissue membrane over the throat and tonsils, and finally myocarditis and peripheral neuropathy can happen in very severe cases in children. Talking about the prevention and cure, first of all, DPT vaccine has to be given to all the children below 5 years of age, and this starts very early for a given child. Immediate medical attention has to be brought in. Disposing of the sputum and the oral and nasal discharges of this infected child. Antibiotics have to be given, and isolation of the infected child has to be done, because as I said that this is also, just remember this, that this is also very highly contagious. So that's why all these preventive measures have to be taken so that it does not spread to other children very quickly. The next disease is leprosy. Now when we talk about leprosy, what we know today is that more than 60% of the cases worldwide are seen just in India. India has the largest number of patients with regards to leprosy. It's not just with leprosy, even with tuberculosis we have seen that the largest number of people infected with tuberculosis are actually from India. So that's why India has taken a large vaccination drive both for tuberculosis and also for leprosy. Now we are starting. Now when it comes to leprosy, generally what it has been observed is that BCG vaccine is also given as a precaution against leprosy. Although BCG vaccine, as we have discussed, that it is meant for tuberculosis, but since the bacteria are very similar to one another, that's why BCG vaccine administered that can act against leprosy cases as well. But eventually in India, for the first time in the world, we developed a vaccine against leprosy. The name of the vaccine is Mycobacterium indicus prani. Now this has been named so mainly because Mycobacterium is the bacteria from where it has been taken, indicus because it has been developed in India, and prani basically comes from Dr. Pran Talwar, because it was Dr. Pran Talwar who in 1970s had started to work on leprosy vaccine, and finally almost after 36 years of testing, finally leprosy vaccine back in 2016 for the first time was approved in India. And then after that the trials had started. For example, the trials started from Gujarat, where in 4 of the districts where leprosy is seen as endemic disease, this is where the vaccine against leprosy for the first time as a trial run was started. At the same time, if you go back into the history of testing of this particular vaccine, you will see that in 1990s for the first time the trials had started in India, and it started to show positive results, that people, or especially the people who are living in the vicinity of the patients, they were administered the vaccine, and it started to show that they were starting to develop antibodies which can act against leprosy. So that's why we saw the first taste of success in the 1990s. The tests kept on happening, and ultimately in 2016 we decided that we can go forward with mass production of this particular vaccine. So the world's first vaccine against leprosy has been developed in India. Just remember this. Annually we have seen that more than 1.25 lakh cases exist in India in total, and out of these 1.25 lakh cases, this is almost 60% of the entire world cases of leprosy. So that's why it is on India actually also to make sure that India has a strategy against leprosy, and that is where this particular vaccine also comes into the picture. Now, when we talk about the transmission of the disease, it is also a kind of droplet infection, but the incubation period is very long. That although it is infectious, this can be contagious, but the infection period or the incubation period is very long. So that's why again it is not a disease where you will catch the disease from a stranger. Even in case of tuberculosis also we discussed this, that you will not catch tuberculosis from a stranger. Chances are that if you are living with the patient, if the patient works with you, then in that case over a period of time you may develop TB. In case of leprosy, it takes even much longer than that. That if you have a family member, for example, who is affected with leprosy, infected with leprosy, then in that case over a period of time you might develop it. On an average, the incubation period is seen to be more than 5 years. It is at least more than 1 year. So unless somebody has been living with the patient for more than 1 year, the chances that leprosy will develop in people living in this vicinity are fairly low. And these are the target people. These are the people whom the vaccines will be administered to. So there are states that have been chosen. For example, in Bihar, massive vaccination drives will happen. So this is something that the government is trying to do with regards to leprosy. Talking about the symptoms of the disease: skin lesions consistent with leprosy, loss of eyebrows, sensory loss with or without thickened nerves, formation of nodules or ulcers, and positive skin smears. Overall, what can also happen is that it can lead to complete deformation of fingers and toes. So that's why those are the symptoms of leprosy, and it has to be contained. It cannot be reversed if it has already started, but it can be contained. So prevention early, easily curable if the disease has been treated early, and there is this multi-drug therapy that has been done, and especially the medicines which are used against tuberculosis, the same kind of vaccine can also be used against leprosy.